Mindfulness is the awareness that emerges when paying attention, that's another important word, in a particular way. So awareness, attention, like vitakka vichara, in a particular way. And what is the way? On purpose, in the present moment, non-judgmentally. So there's a lot to think about, you know. I think that's a very major contribution. He took the, I'm sure Bhante might explain later, that this captures in a sense the essence of mindfulness as described in the Sutta Pitaka, as described in Dhammasangani, for example, which Bhante alluded to when he said about recalling and so on. But then, now this is not enough. It's what we call a conceptual definition. Now if you want to do research with this, if you want to make applications with this, then you have to measure it, because measurement is at the heart of scientific methods of inquiry. Of course, yes. So now this happened about 40-50 years ago, and now the definition was debated upon, it was improved, concepts were, expansions were made, and an operational definition was also done. But while all these things were happening, the concept of mindfulness caught on, because by developing mindfulness, clearly people are going to feel better. So he first applied this for stress management, for stress reduction. So he had like a 8-week program, a group therapy as he called it, for a group of 8-10 people. And what happened, it was 8 weeks, like one session per week. One session per week, and there was what is called psychoeducation, basically giving information, correct information about the brain, about the mind, how you feel and how you can feel better, that kind of thing, and meditation, but a mix of meditation methods.
And what was the outcome of this?
Outcome of it was that people felt less stressed, relieved. It was also experimentally proved, the stress levels at the beginning, stress levels at the end, and as the professor said, when that meditation is done, the activities of certain parts of the brain changes, calms, kind of rays that emit are different, that kind of thing. So this has now developed. Mindfulness-based psychotherapy is one of the most researched and in fact most highly funded areas. More than 250 interventions, psychological interventions, have been developed for a range of psychological or psychiatric disorders, going from very common ones like depression. For example, when people have depression and they go into remission, there is always a tendency for the depression to relapse. And he showed that with that therapy that he developed, after him, other people took on and made sort of developed interventions for other conditions, depression to delay the relapse, for substance abuse again to delay the relapse. Then there's anxiety,
and it was successful.
And it was successful, but there is a question mark there. We don't know. Yeah, let's say it was successful because symptoms reduced. Symptoms reduced. Then there have been experiments with, I'm not particularly sure whether there were experiments for this group therapy, I'm not sure, but symptom relief was definitely established by experiments which measure the level of symptoms before and after. And for very major ones, even there are things called borderline personality disorder, with people with that condition tend to self-harm. They are the ones who jump off, heights to kill themselves, cut themselves with knives and so on. Even for those, adaptations of this technique have been used.
Bhante, back to tranquil wisdom inside meditation. What are the stages of mind a normal person can reach by doing TWIM? And how does one know that this person has reached this particular stage? How would one know?
Oh boy. When I give a retreat, one of the things that I tell people about is the Buddha came up with a word that is called samadhi. And that word has been redefined over the years to mean absorption concentration or one-pointed concentration. But the actual word samadhi was made up by the Buddha so that he could explain that there is a different kind of awareness than one-pointed concentration. With one-pointed concentration, your mind zooms in just on one thing,
Yes.
to the exclusion of everything else. You get to a place that you don't hear anything, or if I come up and I hit you with a stick, you won't feel it. Now this is what they call jhana practice, but actually this is more of a Hindu practice than a Buddhist practice.
Why do you say that, Bhante?
Because what the Buddha taught was to do